There, the drive
Same
back.
thing.
On the snowmobile, you can start.
Oh, I'm sorry.
They have gone all the way back to Vermont from our house. They're quite a way. They're going snowmobiling.
Hey, good morning, everybody. We can start the Human Services meeting. And do we have a motion to accept the minutes of January 25th?
So,
Cassie, thank you. And so maybe is he leaving?
he forgot where he was.
I sat in the wrong place.
Okay. I'm not sure what we did, but that's okay. Anyways, Mike, do you want to come on? Thank you. You for report?
Morning, everyone.
Morning.
First on the agenda is I'd like to ask request that you could appoint the following: Katie Paddock from the Town of Whitehall, Lauren Archambault, Town of Cambridge, James Benefield, Town of Kingsbury, Claire Tolman to the Youth Board. This group, the Youth Board, is the group that actually allocates the resources to the youth development program funding, special funding that we have for youth in the county.
Make a motion. Okay.
I'll second that.
Okay. Any question or discussion?
Do the towns recommend? Do they?
Actually, in the past, I've had some supervisors recommend. We try to spread out the recommendations throughout the county, but it's not protocol. But by any all means, if you have someone from your town that you'd like to have considered, you certainly would reach out to them and talk to them about responsibilities and if they have an interest in participating.
So it's a self-nominating process, I guess, more or less.
Well, the board can bring someone forward, or I have to. Our bylaws require us to have a minimum amount to meet the bylaws to receive state funding, so that's what I'm operating on. And with proximity with the kids, Zoom really opened up the ability to kids, youth being available after school. So 2 out of these 4 are youth that are available to Zoom into our meetings that reside in the Cambridge area. But so someone from the northern part of the county with Zoom access shouldn't be an issue at all. So we are open. There's on how we received. Actually, received a call last week from Cambridge residents that wants to know how they can get their daughter involved in county government. So we're open.
Thank you.
All right, sorry.
That's okay.
Mike, how often do they meet?
Our bylaws require us to meet two times a year to allocate funding, but this year is an anomaly in that the state is changing the fiscal year.
Yeah.
So we'll be meeting a minimum of 4 times this year. But the time commitment, I try to bring in department heads from the county to be on it, that we collectively work with on different initiatives. But we've emphasis over the last few years getting youth involved. So it's this year will be 4 years, and then 4 times, and then next year should go back to the 2 or as needed.
Mike, when you say getting into what agency?
I like the 14 and up to 20. So, when you sit around the table and you're sitting there with the DA, and the commissioner can be quite intimidating. So, so it's nice to see the interaction, but it's been a few years with Zoom. I mean, with COVID and incorporating Zoom, it's been different. So hopefully we're going to go back to in person and have the kids experience that, to interact with the department heads. All right, thank you. So the next up on the agenda. I'm sorry, did you?
Yeah. Thank you. And all in favor?
Aye.
Thank you. Any opposed? Thank you.
Can you tell I'm in already off the stage? No. All right, thank you. So the next up is a budget amendment It's a carryover of the rural community practice grants fund that we didn't expend last year. And that's a bi-county collaboration with Warren County. It's 100% state funds. And we'd like to carry over $63,012 and broken out between the grant category, which is 2204, and overtime. It's 122. Yeah, revenue code is 122.
That's it.
Any discussions? All in favor?
Aye.
Thank you. And lastly, last year you gave permission to purchase $3,000 in credit cards that we could use for departmental incidental expenses and satisfy some of the conditions of the grant, having to come back to committee. Well, we didn't have such an easy time finding somebody that didn't want a huge fee for purchasing these cards. So what we did find is BJ's, we could get a Visa card down there. It was reasonable, and we can only purchase 1,000 at a time. So last year, out of the 3,000 you approved me to purchase out of the grant, I only purchased 1,000. We still have money left on the card, but this year I'd like permission to purchase the remaining $2,000. And that's 100% safe.
Okay.
Yes.
Second? Jay, second. Okay, any discussion? All in favor?
Aye.
All right, great. And lastly, the planning group for Winterfest decided it's in the best interest that we cancel for this year due to the conditions of it. So we got our fingers crossed for 2024 and bring something back.
Thank you. We're all disappointed.
Yeah, I know. I blame public health.
Well, having been working outside that day, I think it's a good idea to cancel.
But this is
Don't you agree?
I guess this Saturday we're waking to be below zero, and then forming up single digits, and the ice isn't safe. Everything just, unfortunately, is a perfect storm not to happen. So, all right.
Yeah, thank you.
Nature's a terrible business partner.
All right. Thank you very much.
Thank you.
A little bit.
Thank you. Public, you?
I just want to let you know we're used to being blamed for things. I was gonna say.
That's something that you wait into.
Yeah. Good morning, everyone. First thing we have on the agenda, which I believe Matt mentioned yesterday at the government meeting. As you know, we're moving to the Burgoyne campus. That's our plan with the New York State Department of Health because of the operating certificates that we hold. We have to do what's called a certificate of need application to them. It's an administrative application because it is just moving. We're not adding services. So there is a fee with that. Because we are a safety net provider, the fee is actually less, but it is $1,250. And I was just looking for permission to go ahead. It is an electronic payment. And in the past, we've had to get permission to let the treasurer or give the treasurer permission to actually process that fee. We're hoping to submit the application soon once we have everything pulled together. And it is 100% state aid. So we will get that back for Article 6. We're just looking for permission to move forward with that.
Second.
May we need a resolution?
The cleanest way is just to process it as a petty cash through the normal process.
Okay.
I don't need any special authorization.
Okay.
Make that happen.
Okay.
It's a little bit cleaner to do it through petty cash and then run it through the auto second.
Okay. The other part of that is in the application, it does require either a resolution or a letter of consent from the Board of Supervisors authorizing the project. So I'll have to attach that to the application. So we can either do a resolution authorizing the project or a letter of authorization, whichever you choose to do.
Resolution is easy.
Okay.
Okay, so we have a motion on the table for resolution. Do you have a second?
Second.
Resolution for the rights.
Yeah.
Any questions?
Yeah. They look a little devilish, but yeah, I know they're there.
So all in favor?
Aye.
Thank you.
The next item is just an update on our STD clinic. Previous to COVID, we were doing that in conjunction with Marion County at their we do have a contract with them where we pay them quarterly for that service and partnership. It is something that we are required to have through the Department of Health. So we're going to be starting that back up. It's going to look a little bit different. We are going to do it by appointment only. It'll be at Warren County. It's going to start in probably the second week of March. And Warren County has contracted with a Hudson Headwaters provider to come on site to do that. And then one of our nurses will go up every Wednesday to meetings to help the provider. So just more of an FYI that we're going to be starting that back up. So you'll see that advertised. The third thing is we're getting caught up on our annual reports. I won't go into a lot of detail on this because it is old data 4 years ago, but the 2019 annual report is complete. There's two pieces to it. There's the detailed report and then there's an executive summary. I would encourage you to take a look at the executive summary. It'll be on our website and I can also send it to anybody that would like it. It's a lot of color, but it is a great place to start to take a look at the different programs we have and the ones that we're starting to get moving again. Okay, and then we are working on we're going to do a combined report for 2020 and 2021 because it was primarily COVID, and then we'll get back on track with our 2022 report. So those will be coming shortly as well. Okay,
Thank you.
the next item has to do with our preschool program. I do have Diane Cantiella here with me. She's our early intervention official and oversees the preschool program as well. We have 19 providers that we contract with to provide preschool services. That would be speech therapy, occupational therapy, and physical therapy. We set the rate for them. So right now they're paid $45 per visit they make with a child. That's all inclusive. That does include their travel time, any expenses that they have related to the program. The last time we gave them an increase was 2017. We are finding that our neighboring counties are paying quite a bit more than that. And it is restricting us from attracting providers into our county. So we'd like to propose an increase to $53 from $45 to $53. That would put us in line with what our neighboring counties are paying the providers right now. So we do get reimbursement on those visits. We get money from the state education department, as well as we are able to bill Medicaid as well. So the net increase to the county would be $26,500. That is after the reimbursement, but we do have that money within our budget to cover it. So looking to get the approval to move forward with that rate increase in order to attract and retain providers for the preschool program.
Okay,
Yeah, no, I'll second.
second, with discussion.
So within the budget for your department, so I don't believe we gotta go to any outside committees on this, do we? Yes, no.
I'd be in favor of just letting it ride and see how the year plays out, because it's kind of a fluid program. So I would take the wait and see approach on this one.
Yeah, it'll smooth itself out. Probably. So,
It could, sure.
thank you.
Okay, so we'd like it to be effective July 1st. That's the cleanest because that is the beginning of the school year. And they go along with the school year schedule. So there will be an amendment to their current contract. So July 1st would like to be effective.
So does somebody want to make their motion to include the date, July 1st? Is that the change?
That's what you said, right, Jim?
Yes, yes. Nice second. Yeah, second July 1st.
And so all in favor?
Aye.
Aye. Thank you.
The next item, a few months ago, I had brought that we had some expired medical supplies over in our office, and we were looking to give them out to the vet's offices. As we've been cleaning out stuff, we realized that we have quite a few medical supplies that are also not expired that we just will not be able to use in our office. It's not supplies that we purchased. It's supplies that came with our COVID vaccine from the state. We have sent a message out to the state just to verify that we're okay to get rid of those, and they're not gonna, I can't imagine they would ever ask for them back, but you never know, I guess. But anyway, so we're looking to offer those out to the EMTs, agencies, or EMS, so they would be able to get used, because there's just, at this point, we have so much that it's just not practical that we're gonna be able to use them before they expire. So we were just looking for permission to do that.
So
Any discussion? All in favor?
Aye.
Thank you.
Thank you. And then just under miscellaneous, I just have a couple of things. Our rabies clinic schedule is out on our website. People can sign up online. There are specific registration dates that go along with that, and people can sign up online. If they don't have access to online, they can just give our office a call, and we can, get them set up in there for the rabies clinics. The other thing is, I just wanted to mention COVID. We are at a medium community level at this point, that they change it every Thursday, so that could change again tomorrow. We are seeing a little bit of an increase in our hospitalizations. We're up to about 11 hospitalizations as of this morning. Our transmission level is high, but that's more used in the healthcare world to determine what they're going to use for mitigating the transmission. And then as far as flu goes, we just heard on our call this morning that the flu did decrease from last week. It is still widespread, but it has decreased from the previous week. So just want to put that out there.
And it's good to see without a mask.
I know, they finally let us take our masks off.
And the other thing, I just wanted to share with everyone that we had one of the fellows come into the town office last week, and she was just delightful.
Oh,
And
good.
I really enjoyed talking with her and how much she's enjoying the
Yeah.
public health department.
Yeah, it's been a really successful program. We actually were able to, one of our fellows actually was just recently hired for our health educator position that you had approved for us. So that's great. It was the purpose of the program. So yeah, terrific. That's great. Thank
Still
you.
recruiting?
What's that?
Are you still recruiting?
Not for health, we filled that position. Fellows we are.
Oh, thank you.
Yes.
That's what I mean.
Fellows we are, yes.
Strategic recruiting.
Yeah, it is. It's a great lead-in to public health, because just listening to her and that she's came from being here, it was really
Great program.
Thank you. Good job.
Thank you.
Yeah, thanks.
That's all I have.
Good morning. Good morning. Good to see you.
So I'd like to start by sharing with everyone that we are moving forward with our annual March for Meals campaign. It's been a while. The last time that we did this event was back in 2019. So we're excited to move forward and to extend this invitation to everyone here. So at this time, for those of you that aren't really familiar with our March for Meals campaign, it's a time where we highlight our senior nutrition program here in Washington County. And because of that, the invitation that I am extending to each of you will also be extended to our U.S. Senators Gillibrand and Schumer, as well as U.S. Congresswomen Elise Stefanik, Senator Dan Steck, Jacob Ashby, Assemblywoman Carrie Warner, and our Assemblyman Matt Simpson and Scott Bendit. So, our goal in this is really to share with everyone what the theme is for this year, which is a nice piece of the puzzle. So the theme for this year is Cooking Up Community, which highlights two cornerstones to our nutrition program, which is food and connections. So our program, as you know, is funded by state, federal, and local dollars. And our program truly serves to build and improve our community through meals, social connections, education, and so much more. So at this time, our event is going to be on March 16th. The details of the day's event are included in the invitation. In addition, I have also invited certain department heads to also partake in the day's event. I thought it would be nice for people who support our program over the years to come and see the actual process as well. To give you some data, in 2022, our office served a total of 87,450 meals. And this is broken down to 618 home delivered meal participants and 294 senior dining site participants. So again, invitation will be shared with each of you, and we ask that you just RSVP. We can have a personal conversation with you. If you wish to go out on the delivery route that day, we can talk about where you want to serve. If you want to go to your communities, we can absolutely accommodate that as well.
Is that in Whitehall?
Pardon?
Are you doing that in Whitehall? That's the flyer I saw.
Not sure the flyer. We haven't publicized this yet, but this will serve Whitehall. So our current meal routes that we have on this day, we can make accommodations. So like, for instance, if you wanted to go in to your area, we can look at that route. If you're restricted on time, we can accommodate that as well. Our goal here is really to have you experience, what our seasoned drivers experience on a daily basis.
Daryl, when I went on it for the first time, it was one of the most rewarding days. And actually, like what we did was we started in the kitchen. So they walked us through the kitchen and how they package up the meals and put them into the vans, and you get to ride with the driver and visit everybody in their homes as you bring their meals to them.
Okay, so it starts down here.
That's the same.
So the day's events will start at the kitchen if you're able to accommodate that. Again, if you need to start in your community or at a certain location, we can do that as well. But yeah, we'd like to start at the kitchen because that is a pretty interesting process to observe, starting with the meals being served off the line, down to where we bring the cargo boxes out to the loading dock, watching the drivers come in, grab those, and then go over to the Burgoyne site. And that's where everything is distributed to all of the drivers. They
Is
then go to
this a
the-
corned beef meal, given its date?
So ironically, it is. Yeah. So I did-
All in then. You ever have leftovers?
Most certainly, we will be providing you one of our wonderful meals this day. It wasn't necessarily planned to be the meal for that day. I did speak with the sheriff because we are using, we're going to be going into his facility. And I gave him a list of dates, and March 16th was the corned beef with cabbage meal. So that date seemed to work well for everyone. So ironically, it is the 9%.
Okay, I'm all in.
The other piece to it is, in addition to the home delivered meals and the drivers, we do operate the 3 senior dining sites in Washington County. And so if you want to go and see one of the sites and see how that operation is done, you're welcome to do that. Or if this day doesn't work for you at all, we can accommodate you on a different day. So this is just the day that we're highlighting here, but we can most certainly be flexible.
Where are those?
Sites are in Cambridge, Whitehall, and Kingsbury, Fort Edward, right here in Hudson Falls. Pass this down.
It really is a worthwhile day, and if you have time and you can schedule it into everybody's busy schedules, I think you'll find out that it is actually really, when you sit around this table, you can easily lose touch with the people we serve. And if you go into people's homes and meet them at their table or meet them when they're sitting next to their couch, although I have to say that the driver that I rode with, who was amazing. He's an incredible.
So our drivers are all part-time and per diem staff.
And he was wonderful. He kept I said, oh, you don't have to go in here, you don't have to go through that mud tunnel and everything. I'm here to go into people's homes. And that's why I came along. And then at the end, he's going, now Sue, because we got to get lunch on time to these folks because I was talking too much. So with that.
So most certainly on that, our drivers are well trained because they know that we have temperatures that we have, like each meal is served at certain temperatures, which is part of the process. Like it's just not loading up the meals and hitting the road. It's making sure temperatures are up to temp and that everything is, all moving forward.
And he really knows his people. He knows.
Yeah.
They do such a good job. We're very thankful for that.
We're excited to host. So I do have one other miscellaneous item. So we were just notified that the New York State Office for Aging is partnering with an outside company called Polco, Polco, to do a comprehensive needs assessment across New York State. And so this assessment is to gather direct feedback from residents age 60 and over to better understand the contributions that older adults make to their communities and to identify their challenges and their unmet needs. The feedback that is gathered through this community assessment will be used to help local agencies as well as the state in terms of future planning. So typically, before we write our 4-year plan, we locally conduct our own needs assessment, which is what we've done in past years. So this year, NYSOPA has said, you know what, we're going to take this on and hire this company and pay for the postage and all of the pieces that come with this and send out the survey. So the survey is going to be sent out to randomly selected households within Washington County. I'm not sure who those households are. The reason why I'm sharing this with you today is just to let you know that we're always warning people of scams and phishing attempts and all of that. And so I just wanted to emphasize that the survey that people are getting is truly legit and that it's valid. So if people come to you and ask questions around it, that you can share with them that this is something that is that they can participate in. So at this time we're started the process of advertising this, trying to get the word out to people through our Community Connections newspaper as well as Facebook and our website. So we're really emphasizing to the community that if you are a randomly selected household, to please participate. That information again is going to come right back to local agencies for planning and then for them to know that it is legitimate, not a scam. There's also an online piece too. I'm not sure how that's going to play out. They mentioned that they're going to be offering the survey online. And so I don't know at that time if it's going to be sent by postcard to randomly selected households to say you can either do paper or online, or if that online survey is going to be open to everyone. So if that online survey is open to anyone in Washington County, 60 and older, we're going to highlight that and really do our best to get as many participants as we can.
Any questions on that? Yep.
I want to get back to Meals on Wheels. You said March 16th,
Correct.
which is our finance meeting.
Time's that then.
Then I think we start gathering for Meals on Wheels about 11, don't we?
So,
I guess we'll have to hurry up to finance.
Finance.
yes,
Finance starts at 8.
No, that would be the day before the board
Day
meeting.
before the board.
Oh, that's, I'm sorry.
Yeah, board meeting's early in March again.
Focused.
so
No,
no,
heart attack.
yeah, thank you, because Debbie and I did work together before selecting this date to make sure
Why'd you
that
say
there
that
was no
first?
committees on the dates that I just
Why'd you say that
Throw
first?
that
So, yeah, so we did look at the calendars of everyone to see if we could pick a date.
Memory is the part
So,
of
yeah.
chat on senior needs, Dave.
It's getting worse.
Make sure you get a postcard, Jake. Square green.
Say that. Give it a moment.
I think it was. Thank you.
All right. Thank you very much.
Thank you. Yeah, you too. Okay. For being here. sure? I wouldn't miss this 2 months in a row. So good morning, everybody.
Morning.
I'd like to start off with some budget amendments, and I believe, budget amendments. I believe that the material is in your packets. I think it's in the order that I have, so. So the first one should be to transfer 2022 HEAP ARP funds, shifting 141,621 from a 0.4 account to a 2.2 account to cover the full cost of assets purchased with the 100% federal funds. Okay,
So, second.
any questions? All in favor?
Aye.
Thank you. The second is to utilize unspent 2022 Medicaid appropriation to cover a shortfall in the area of safety net. The amount being transferred between accounts is $200,000, and there is a slight offset of state aid in the value of the.
So move.
Any discussion? All in favor?
Aye.
The third is to carry over remaining 2022 Washington County ARPA funds transferred for foster care recruitment and the expansion of daycare services to the 2023 budget.
So move. Second.
Any discussion? All in favor?
Aye.
Moving on, I'd like to transfer 2022 ARP funds to the DSS regular earnings to account for wages expense specifically for foster care recruitment.
Second.
Any discussion? All in favor?
Aye.
And last, transfer portions of the approved 2023 computer equipment budget to office supplies and equipment non-asset to align the funding with the proper categories.
So move.
Passing. Any discussion? All in favor?
Aye.
Thank you. You're welcome. Got momentum going, folks. Moving on to the SNAP administrative allocation. I received notification earlier this month that additional SNAP, and SNAP is the Supplemental Nutrition Assistance Program used to be food stamps, administrative funding provided under the American Rescue Act of 2021. It's being allocated now to counties for federal fiscal year 2023 due to processing the growing number of SNAP applications. In Washington County is being allocated $56,541. And I don't believe that we need to do anything officially with that. It'll just be extra revenue that we're able to pull down.
Sure.
However, while I'm talking about SNAP, I want to add on a couple of things. So I'd like to take a moment to remind you that this is the last month that people will be receiving the SNAP emergency allotments. That's something that was a federal program, and it started back in March, I believe, of 2020. And it provided an extra payment each month to everyone who was receiving SNAP. So it gave them what would have been the maximum rate that they could have received for their household size. Whereas if their income and such things would have been included in that equation prior to this emergency allotment, they would have gotten a smaller amount because they had income or whatever the case may be for those situations. So it isn't a number that I can put a finger on for you, but it's significant. There will be people that have a whole lot less money coming to them than what they have been accustomed to since, in most cases, since 2020. It will depend. Some people maybe have just come on to SNAP and wouldn't be used to it, but it will be a lot less money that people will be receiving. I took a little dive on that yesterday to try to see what data I could provide to you. And I figured that given all these numbers was going to be too much, so I made a little chart.
Operative word little.
At least you can read it.
Well, the font, I can read it. Where is it?
The font size is readable, so thank you. When we first started typing our own documents, actually, in social services, we checked with, at that time, it was Judge Burke, to find out what size font we should use. And it was 12. So that's
That's what I usually go with.
Thank you. Those of us that can't see it.
Yeah, we got one report one day and I'm going to Sue, I can't read this at all, and I'm staring there and I go, oh, this might help. I really had no idea, something made me realize I had it completely upside down. It's like, I was going here.
So to be able to share with you what the history has been of the SNAP program, the total benefits that have been paid out or the expenditures over the last few years. So I have 2019, which was obviously post or pre-COVID. And at that point, the total expenditures for SNAP coming into Washington County recipients was just over $8 million. Fast forward to this past year, 2022, and it is nearly $21 million. So it is incredibly, it's grown incredibly, and it will now decrease, I think, probably not to that same degree, because I'm sure there are certainly more people that are eligible. You can also see that the number of households that have been served has continued to increase over those years.
Well, not to mention the inflationary value that I hope it doesn't drop to that pre-pandemic level.
I don't think that they figure in inflation. The benefits at the very least for cash assistance have not increased due to inflation in 20 years. So I'm not sure that there's going to be a big build in for that, but I think we could end up seeing it be almost half that will be cut moving forward. So I wanted to make you aware of that as it relates to people in your communities. The dependence on food pantries right now is already quite high, quite demanding. It's only going to get worse.
So I have a question. So when, I'm not real sharp on the SNAP benefits, but they did send out text messages about that.
Okay.
And I was contacted by several elderly because first they didn't know what that was on their phone, so I found that on their phone. But- So what you said is before they got 2 payments, and then when they got a bump up to a 3rd payment?
This became the second allocation. So they would have had, depending on what day, somehow there's something that I don't know either in the world of eligibility that indicated which part of the month their regular benefit would come. And then this is the second allotment.
So now they'll go back to getting 1 payment.
Yes. Anything that they have built up, they can continue to hold over. That can stay on their card for up to a year. So they will still be able to, if they've had some savings, if they've been able to have something there, but it will then start to tick down.
Okay. They only take away what's a year over 284 days.
Yes. Look at you.
I don't got
You
it
sell
right.
yourself short. You know a lot. I just read that yesterday.
Sure.
Oh. All right, now you're even.
But there's been a lot of publicity. It's been out in the news. We have it on our website also. They have sent letters directly to the recipients, but they would have had to open the envelope and understand, which is probably in a size 10 font.
Yeah.
The letter.
Nobody's asked me about the letter. They asked me about the text message. So, because so many of them have flip phones, they don't even know how to. They're like, what's it from my phone? Right.
Just a comment, it's interesting that the number of recipients went up by about 12%. And the total amount distributed went up by 250%. I was surprised that the recipients didn't go up based on the past 2 or 3 years.
Recipients have gone up based
It
on
was
the
only
list.
about 12%. I would have expected a larger jump.
I think the food pantries have seen the larger jump. It's-
My concern is food insecurities have second and third order impacts that are translating to health services.
Yeah.
List goes on and on, so.
And it's amazing because in their communities, like before they would maybe rely on one day that the food pantry was open. I'm just using Salem as an example. But what they've started using is putting food in the libraries. And that has been a huge success. And it comes in on Thursdays, everything is filled up in there's boxes everywhere within a couple of days. And what I find interesting is I see kids running in there to get after school snacks because they sometimes will leave apples or oranges whatever. And so the kids have decided that's the new stewards. So they don't have to pay for it. They will run in and get an after school snack. I personally like seeing that. It's a tremendous asset for our rural communities, is that food distribution.
It's gonna be a scary thing. It is an income-based program. So as far as how many more people became eligible for it, would have been controlled by certainly some of the other benefits that people were also receiving throughout that period of time. Ready to move on?
That's more good news.
Sure. Well, I do have, the next thing honestly makes my staff happy, so that matters.
That's all good.
So I would like to move the HEAP and homeless on-call into a year-round on-call at this point. So to refresh your memories, last fall, the committee agreed to support my request to split out duties that were related to HEAP and homeless from the traditional on-call that responds to our child welfare emergencies. We started in September, and I had told you at the time that we would run it through March as a pilot, and then I would reassess. I also told you at the time that doing that was going to alleviate stress from the caseworkers, which was a title that had been hard hit from the impacts of turnover and just the difficult cases that they're working on. I also said it would be welcomed by my examiners who would be taking that duty on and would now have a chance to earn some comp time and some extra pay. So it has worked well. It's been very positive. We do still have a very high number of calls for our child welfare on call. All too frequently, it's 25 hours or more in the span of a weekend. So it's adding anything more into that would certainly come as a hit for them. It is more about the homeless situations than anything, the work that they're having to do. And I imagine that though HEAP, we'll see the area warm up and there'll no longer be HEAP benefits. We will continue to have homeless for a period of time at the very least. The supervisors that oversee the child welfare on-call are the same people that are overseeing this on-call at the same time. And so they are monitoring how many hours the HEAP and homeless workers are working and not understand that if they're doing 5 hours on a weekend, that 5 would then go into the child protective or child welfare situation also. I think the fiscal impact of being manageable. The workers have an opportunity to take either the stipend, which is for them being on, the standby for being on call, or 4 hours of comp time each night of coverage. The total cost of the stipends and the overtime that was used for running this in November, December, and January, the stipends was a total of $3,300, and the overtime was 51.25 hours. So the 51.25 would have had to be done regardless, and it would, if it were part of child welfare, it would be a title that's at a higher grade level also. So there is some slight savings there by having it through this. So I would like to be able to continue to do it through the rest of the year. Currently, on-call is in our contract. That was what drove the rates that we paid for this. It does not specify what kind of on-call it is. At this point, I would not recommend us writing anything more specific in about this. It may be that we won't need to do this every year moving forward, but for the time being, I foresee it as being beneficial.
Any questions for Tammy on this? Remember, this was the teamwork and working within the department to, actually respond to.
Help with the staff.
And I agree, staying a little broader in their description of support allows flexibility to modify as conditions change to balance all that stuff out. So
So it's about $1,000 a month difference.
So it's,
900.
and we claim that cost also. So there would be, also then funding that would come back to us for that. That was gross number.
It's a way to serve the community. Any other questions?
No, I just
suggest that maybe so it stays in everybody's forefront of the mind. We talk about it again in the fall.
Sure.
To see how the summer went,
Mhm.
but, you know, just to follow up and see how the second half of the pilot program went.
Okay. It's certainly budget
Keep it
time.
so it keeps them.
Yep, budget time will be appropriate.
Yep. Okay. Any other questions? Okay, do we have a-
I don't know what's needed, if the resolution is needed.
just a-
If so, I'll make that.
I don't think you had a resolution last time, it was just giving you approval.
Okay,
Okay, and there wasn't a time frame attached to that motion last time for 3 months and that was it?
It did say temporary.
yeah, and I said that I would come back, and it says specifically in the notes that I would come back in March, or that I would ask about it again, or to continue past March.
So we revisited and we agreed.
Yeah, thank you.
And Daryl's motion, we're just gonna let it slide? Or do we have a second and just cover ourselves? We got a second? Okay, and to let it go into
We'll
September,
follow up in the fall during budget time to see how it's going.
and on favor?
Aye.
Thank you.
Hope we didn't confuse them.
We didn't throw anything at us. And we might not know she may be throwing it at Dave.
She makes everything right. That makes everything right. Thanks, Lloyd.
So we're gonna revisit something else too that came last month. So I want to work into this by explaining the structure of DSS. The organizational structure at DSS consists of me having immediate oversight over 3 different DSS division directors. Gina works with us in that group, but she is an unusual situation. She, of course, is a department head. It's through the union of our staff, through an MOU that we have that relationship where she does also oversee adult services programs for DSS. So that's the structure. It's 4 separate divisions, but Gina is not. I do not have direct oversight of her. Within those divisions, there's unit supervisors, and there's a total of 15 of them. So one of them is also an OFA employee, but we all work together as a management team. Supervisors then in turn oversee the titles that say senior in front of them. So the sequential titles, they oversee them, and then they oversee the front line. So it's that sequence down through that, of course, would understand. There are 23 supervising seniors that are the frontline leaders within the agency that provide direct oversight to our frontline workers. This is the structure that we've had now for the last, I honestly, I think the structure has been that way for us forever, probably, but having those seniors actually provide direct supervision is something that came into place during my time as commissioner. So I know that the wording that I gave to Gina to use here last month, which included that DSS has a long history of working with a specific consulting practice, was a bit misunderstood. It certainly wasn't intended to be misleading, but it would have been more appropriate for me to have explained that we have a history that extends back to 1999 with the consulting practice, but we have not had the full leadership skills training as a series since 2007. Of the 20 managers that I mentioned to you, 12 of us had that leadership training 16 years ago. 8 of them were a senior at that time. They were not an actual manager. So it was all a whole lot of very new material for them. And only 4 of us had it while we were managers. And I am the only one that also had it in 1999. So to explain what our history has been, it has not been as in-depth working with that consulting practice to drive home for our supervisors what the proper management techniques would be, leadership skills. We have had smaller presentations through the years from them, but we haven't worked with them since 2013 because they cut back at that point on the services they were providing. But it is the leadership model that we base our supervision and our performance expectations on. In the absence of working with that consulting practice, which is Grove Associates, we have engaged in different development workshops with a variety of trainers, but it really just hasn't ever been anything that truly fits the model that we use, which is built around leadership techniques, but understanding that we are also in the world of civil service and that we have a contract with half of our staff. So it's really modeled to us and what our needs are. It was clear to me that we needed a full leadership curriculum before the onset of the pandemic. Since that time, we've been doing our best, but obviously with all of the crisis that's been happening, we spend more time responding to issues than we do developing skills. I think that Gina shared last month that we had retirements that were happening. So in the first 2 months of this year, we've had 3 people retire. 2 of them were supervisor level. 1 of them was a senior level. Within the next 2.5 years, we will have some other high level retirements. 1 of them being at a director level and 1 of them being me. So I feel that it's critical to boost the foundational skills and the people that are currently managing and to target skill development in the mid-level and the up and coming leaders as well to be able to move forward. Knowing about all of that past experience, we conducted the training needs assessment with Grove in the fall of 2022. That is something that I would have spoken about at budget time, because also in the process of the budget and providing our training and travel plan, it also speaks to the fact that we anticipated looking toward leadership skill development for this year. And it is actually mentioned in some of the minutes that going back to that meeting also. So I would like to be able to go forward and build off of the results from that survey, and which identified some need areas in the area of morale, priorities, trust, and empowerment. Again, this is something that we did that's like an above and beyond assessment of ourselves and our leaders and what we are providing for our front line. It is not something that's required by any entity of the state oversight or anything that has been required by the county, but it's something extra that I feel is important to be able to do to support our staff. So I would like to request a waiver from the RFP procurement process to continue our work with Grove Associates and be able to move forward with some training that will directly complement what we do for our model of supervision and our performance management. I will remind you that we get up to 75% reimbursement from any of our training and any of the costs that are associated with that. We also receive a direct funding allocation from the state for training because of the recognition that there is a lot of skilled positions and it's important within our department.
I'm going to interrupt you, Tammy. Tammy was and invited us to come to the session downstairs. Melissa and myself, Bob Hankey went, and fortunately they saved me a seat because by the time I got down there, it was not a seat in the house. The room was absolutely full, and you could have heard a pin drop. They had people talking about what it is to, what the leadership skill is, what the roles and the criteria are for each job, and kind of just talked about it in a way that was informative, educational, fun, because he spoke very well and kind of brought people on board with what we were there for, and just talking about what's looking ahead. So I support him. It was like going back from a different world, from being a town supervisor back to the old days when I worked with OMH, and realizing, how important that is to have that support for each other and knowing what everyone's jobs descriptions are and kind of staying in your own lane, because it's easy to get in crisis. Somebody has to know who the leader is. And
yeah, and some of the dissatisfaction that we have within our staff is they feel that they have not been consulted on some of the changes that we've made. And it's building for them the understanding that your supervisors are speaking on your behalf and representing what your needs are to us as we build these things. And then there are certain things we can't ask for input on everything that we do. So it's helping them understand these roles too.
So to summarize, you're requesting an RFP waiver because you did the first part of this with that company already. You would rather continue working with that company for the training that the state helps to pay for and you have in your budget because you already started working. That's really what you're asking for today.
Is your name Hicks?
I know, I could hear that in my head and I was like, oh my God.
In short, yes.
I did, I could hear that in my head.
In short, yes, this work that we started with them at the end of last year is work that we had done with them in the past too. That's why I went back to them for that continuity.
Is what you need from us. I am next day. What you need from us is just a waiver permission. Or I don't have any problem with the training or that. That's all needed. It's in your budget, correct? The state's gonna help reimburse it. That's correct. So really the only thing we have to decide is the RFP waiver. Yeah. Did you second it?
Jay seconded it, and then we'll go for discussion and Sam's got.
Yeah, my comment wasn't, after your meeting the other day, I did talk specifically with the chairman about this. And a couple other issues are going to be on for committee meetings, since he was going to be out of town. And I do know that he supports the initiative to approve the meeting. So I just wanted to do that.
Yeah, that's where I was going. We had some conversations about this a couple of weeks ago. So I guess we've all reached a more comfortable position on it. Okay.
Okay, so we have a motion on the table, been seconded. Any more discussion? Okay, all in favor?
Aye.
Opposed? Okay, thank you very much.
Thank you.
Yeah,
And
I was mad, I think.
indeed.
I know, I had to do more times here as long as my meetings
What kind of
are.
coffee did you have this morning? Right.
And then I wasn't sure if there were other questions. I know there's been stuff circulating around FMAP. I could fumble through a little bit of conversation related to that. You had emailed me yesterday on a question related to the childcare people reaching out to you. So are there other questions?
That the topic of childcare
Oh,
will
that's huge.
come up. There are different, lots of different models on how to do that, right? Not that I'm showing my progressive side, but it does impact our economy. So more to follow on that one. I'm not sure. I didn't get a chance to see if you replied back.
I did.
I'm just not sure where we go collectively.
And it has a trickle down effect with childcare. You look at a little sheet here and families and households that are homeless. And if you want them to be able to go back to them, and if they don't have a place
Right.
to help them support their. There's a lot of domino effect here. It's so difficult.
And let the market decide.
Yeah.
You know, with the barriers to entry and the high costs of sustaining. You know, that is a young family. Working just to put your child in and pay for child support. You're not
Yeah.
getting anything really out of it. And
Just that goal of moving higher in your
Yeah, it's
organization
just-
when you stick it through.
And, you know, I encountered that early on in my life. When, you know, my wife and I had this conversation, to go back to the workforce or not. And when you do that, it's like, why?
It's really more stress.
Right.
Yeah.
So I don't know what the answer is, but
And-
status quo is not necessarily going to get us where we need to be.
Right. So with this initiative that we have rolled out here with the county and using the county's designation to be able to use some of the ARPA funds toward it, we're just going after a low-hanging fruit right now for in-home childcare providers to try to, help people follow through, understand what it means to set up that business within your home, what you need, and assist them in paying for those initial costs and help them build the proper expectations to be able to manage that as a business and then be able to have other people have their children go to them. There's such an absence of it available across our county that it's been defined as a childcare desert. There are other models, like you said, you could put it into your place of employment. You could have certainly large daycare centers. The funding that we have is not sufficient for that, but at least this is to try to push in something that we could see some benefits of right away.
So have we had people reach out? Have we
Yes.
become-
Yep, we have.
Good for
And
members?
we talked about having them come back and be able to give us more information, but I'm quite surprised because we talk all the time about how do we advertise things, how do we get the word out, what are the big ways to capture people's attention. Whitehall was definitely one of the areas that was targeted, and so since I live in Whitehall, I was asked to carry flyers there, and so I did. I went around to some stores, put them up on the windows, and they got calls because people had seen them. So like the grassroots part worked. And I know what she's asking for now from the Child Care Network is reaching out to board members to say, is there somebody in your town we can come and talk to be able to get the word out there, to do a presentation, give more information.
The current movement on Medicaid is not.
No. So right now in the proposed executive budget, they're looking to no longer pass through the FMAP savings to the counties. And that is currently the argument at that point about what they are obligated to provide to us. One of the things that I had shared previously was the numbers of people that are receiving Medicaid coverage in the state have just exploded over the last couple of years. So the money has to come from someplace. They're going to hit us somehow. I don't know how, if not this, it's going to be something else. But I feel like one of the things that needs to happen is take a look at what that Medicaid coverage is and roll back some of that benefit, which is probably not a very popular position with our current government, for sure.
And we currently enjoy two different FMAP reductions, and they're both going to go away.
Yes.
One by the budget, and one just by the nature of it. I guess the silver lining, while $2.1 million is uncomfortable, it's just going to bring us back to the cap level we were at before they were introduced. So while $2.1 million is a lot of money, it's going to bring us back to a Medicaid level that we were paying for in 2018-19. So yes, it's going to be an uncomfortable transition possibly, but it's going to bring us back to a level that we were at, to our cap level before those reductions were introduced. So it's $2.1 million sounds extremely scary, and I'm not pleased by it. But so long as the cap remains in effect, I could get worse.
It's interesting because I'm going through audit this past week and looking at the different invoices and looking at, what the county pays compared to what the Medicaid pays on different invoices all the way through our process, and think, okay, is that portion now going to become county responsibility? Because we'll have 100% of the cost, right? Some of the,
So the FMAP just reduces our weekly share amount, so we won't change the current structure.
okay,
So our Medicaid costs are capped.
okay,
So what they do is they take our cap, and then they've given us these two reductions against the cap. There's a COVID reduction and there's an EFMAP reduction. So EFMAP is what they're proposing to take away in the budget, and the COVID one will just naturally go away. So, like I said, the silver lining is it will bring us back to our cap,
Yeah.
which we were previously at. So it's about $2.1 million to us, which again is no small dollar amount, but it brings us back to a level that we were already funding before COVID.
so it's not necessarily changing some of the services that we were providing before.
You shouldn't see any difference in service or even in cost structure. We as a county, Capital C County, won't see any difference at all, other than that weekly shares amount is going to go back to the pre-COVID level that it was at in 2018-19.
In the past, there has been included in that executive proposal other cuts. One of them has been about the administrative funding. So the cost that we have to administer and determine eligibility of the work that is done within my office is claimed at 100%. we are able to fund that fully. They had in the past had proposed to cut that. And also they have in the past toyed with cutting the cap out and restructuring that. So of the different options.
Where we would need to get extremely vocal is if the cap discussion ever came back up again.
Yeah.
Then I would encourage everyone to be as active as you could, because that is a scary.
Absolutely.
Two different programs. Thank you. Thank you. Anything else for Tammy?
Thank you.
Okay, and do we have any other business to come before the human services? We're adjourned. Thank you, everybody.
Thank you.